Hi, Jan.
Hello, I'm changing, always have to change my name on here because the thing was set up in my husband's name, even though
Yeah,
he doesn't hardly ever uses it, but it is what it is.
it is what it is. Yeah. Hi,
I'm
Maria. We have some more people joining us too.
good. Oyin. Hello, Oyin.
She's still connecting.
Yeah, she's a friend. She's a nurse practitioner.
Hello.
Hi, Oyin.
This meeting is being recorded.
How are
Hi.
you doing, Jan?
Good. Have you seen Sharon or Maria before?
No.
Hi, Oyin.
Hi.
Oyin.
Do you live in the Kansas City area?
Yes, I live in Raymore.
Okay.
And
Wonderful.
you,
Well,
you
welcome tonight
Thank
to this.
you. Thank you.
you practice on the Kansas side, right?
I actually practice both Kansas and Missouri.
Oh, I didn't know you practiced in Missouri too.
So I do go to research hospitals sometimes and Lee
Oh,
Summit and Belton. It just depends on the need.
Well, tell us, how about if everybody, this is very informal. This is Oyin, you haven't been on my Q&A calls before, but Maria and Jan have, so they know.
The
Oh,
recording has stopped.
sorry, I just got a
That's okay.
message. My recording was stopping, and that's okay. I have like a backup recorder, so it'll keep
Okay.
going. So these are very informal, and we just take people's questions, and I'll answer, and also anybody in the group can answer too. I'm sure everybody here has some wisdom and experience, so that's how we run this. And I'll keep admitting people as they come. So who'd like to have something that they'd like to talk about or get some input or some business advice?
So I'm totally new at this. And I've actually talked to Jan because Jan goes to our church. And I was just expressing to her that I'm interested in starting a wellness kind of program, mainly online, where you could, it's basically a business where you could inform people on better ways to improve their health. So it's more a health promotion and disease prevention business. So I have no idea on how to get started on this. So I'm just at the very beginning stage on what I need to do to get this all started.
Okay. Okay, great. Well, you're in you're in the right place because
Okay.
that's what we're all about here. And we're just a really friendly community that listens to each other, and really that's so important because everybody's business is a little different. Everybody lives in a little different community, has a little different ideas, and has different strengths themselves too, and education and all that. So we do teach some systems to help you be organized, but we don't use a cookie cutter approach. Everything is set up so it's customized to each nurse.
Okay.
Okay. And would you like to tell us a little bit about, you've said wellness and online and preventative, and
Right.
so that's still a pretty big.
It is very broad.
Yeah.
Right.
How about your education and your experience and your interest areas? Like what are those?
So I work mainly in gastroenterology and hepatology.
Okay.
So that's less broad, obviously. I have some
Yeah.
experience in renal, which is more kidney stuff. What I've noticed is that the general population just don't know how to navigate throughout the healthcare system sometimes. And
Yeah.
things kind of fall through the cracks, either because number one, they may not have medical insurance. Like, how do they get that information to help them navigate the system? What is more important for you if you're a 45-year-old? Um, what are the necessary screenings that you need to prevent you from getting sick based on your maybe family history or your age and things like that? Um, so those are things that I was thinking about, and I know it is still broad,
No,
but
it's okay. It's
I'm
okay.
not trying to like really narrow it down too much to GI and hepatology, even though that's my area of specialty, and that would be easy for me to kind of go that route if that's what I want to do. But I still think there's a need for other people in other, other areas. So
Sure. Yeah, you're right. You're right. So I'm really glad you're here with Kickstart Your Business because you're going to learn a lot this week. Even though
okay,
the videos are short, they're, you know, they're not fluff. They really
right.
get you
Mhm.
to going. Did you watch the one today?
I have not had a chance to watch it. I literally got off work, had an appointment after that, and it's been like I'm still doing work right now.
Okay. Okay, well that's all right. I understand. I get that. We've all been there, right? And so we're just glad you're here. And those videos will be there all week for you to look
Okay,
at them. And if you still don't have time this week, you can purchase them for just $37,
okay,
and then you'll have them.
perfect.
And
Okay,
I'm recording these question and answer calls every night too.
okay,
So for that $37, you have the question and answer recordings and the video recordings and audio
okay.
on the day's recording. So yeah, that way I know we're all busy, so I wanted to make it portable,
Well,
for people.
doing that, yeah.
Um, so thanks for introducing yourself. If you had one top question tonight, what would that be?
For me,
Hmm.
or one in general. How do you market your business? What's the best way? Am I-
Okay. Well, the best way, it's funny. Let me see how I can answer this. Because marketing, everybody thinks of marketing because we're always getting hit with marketing all the time, right?
right,
Marketing,
right,
marketing, marketing, and
right,
that's what we think it takes to run a business.
right.
And it does, but it's kind of like, do you have children, Oyin?
Yes, I do. I have two boys,
How old are they?
20 and 13.
Oh my, you don't look that old. Okay.
Thank you.
Well, you remember when they were 5 or 6?
Yes.
Okay. If they came to you and said, Mom, I want to go to the next town and visit my friend, would you say, okay, here's the keys to the car?
No, no.
No. So, it's funny, but if I tried to answer how do you market right now,
Right.
it would be like that.
Okay.
You,
Okay.
okay?
Right.
There's things for you to learn
Steps.
and grow and
Oh,
develop
yeah.
before I give
Okay.
you those keys to that car. Otherwise, I mean, you might make it to where you want to go, but chances are you're going to go down wrong streets, you're going to run out of gas, you're going to, it's not going to be a good use of your time and energy to try
Right.
to do that.
Right.
Yeah, I know you have another question. You go ahead.
The
And
reason I said that is, people tell you if you're going to start a business like that, you need to get a website going, you need to get yourself on Facebook, you need to create some videos. And I just felt like I was basically overwhelmed. Like, okay, that's a lot. Like if I start all that, I need some material on there. I need to figure out even my schedule to be able to accommodate this business and figure out how I'm going to even get started on it. So that's why I'm so grateful for this opportunity with you, to talk about ways to even think about what in your experience would be the best way to start. So
yeah. Oh, I'm so glad you're here. because you're absolutely right. Your instinct is telling you, wait a minute, wait a minute.
Right.
I know I'm not ready for all that. And that's right. So we have something called the Liberated Nurse Business Incubator Program.
Okay.
And Jan and Maria have been in it. And Jan's partway through, Maria's through it. And it starts out, it's 5 courses
Okay.
plus coaching. Okay. So there's individual one-on-one coaching,
Okay.
and then there's group coaching.
Okay.
And then there's these home study courses, 5 of them. And you go through them sequentially. Each one builds on the other.
Okay.
And the very first one is called Start With You,
Okay.
because that's where your business really starts, is what is in your heart, what is in your mind, in your vision. Why are you doing this? You know, let's like really start with that and get solid on that a little bit before you just take off.
Right. Right.
And then also it goes along, that course helps you look at what is your license, you know, your nursing license. What are you allowed to do with your license?
Right.
What's your scope and standards of practice? We feel like that is all really important as the base, so that you feel secure to then take the next step and the next step and so on. I'm curious if Jan or Maria would like to comment on Oyin's, you know, questions and all, where she's at. You know, I know you've both been there where she's at. So what would you like to say to her?
Go ahead, Maria. I'll let you start.
I feel like learning about the stages of business, which the video that was for today kind of goes over, was extremely helpful, because that's where I learned, oh, you don't have the website right away. Because it's just like what Sharon said, like everybody thinks these things. And I shared this in a coaching session where I've learned to say, well, the stage of business I'm in, I don't have a website yet, but XYZ, you know, because it doesn't make sense until you figure out who your audience is and all the things. And so I, that foundationally was just like important to know. And then following like all the steps in the courses has just been a game changer. There's no way I'd even be where I'm at right now without kind of that knowledge and the education and the way it's aligned with kind of the nursing process and nursing model. And so, and I don't want to ramble. So anyway, I think that's helpful for me. And I think if you, watch the video when you get a chance, like that'll start making some of that make sense and kind of give you a guidepost of like, oh, this is where I need to actually start. And then it kind of builds from there in a more sustainable way. Mm-hmm.
Thank you.
Well, you know me.
Yeah.
And I told Sharon after our first coaching session, I said, I thought nurse coaching was my niche. So we really had to start decreasing, getting rid of the fluff and what do I actually want? I really wish that I had known Sharon a couple years ago when I started my business. I have the website and, all that kind of stuff that they tell you to do, but I didn't have the foundation and the systems to know where to go and how to, when you're talking about marketing, finding out who you are and what population you specifically want to serve is a big deal. So I'm still learning and love this group. That's why I invited you, Oyin, because I really think this is a really great group.
Does that help you a little bit, Oyin? You're muted.
Thank you. It's just nice to have the opportunity to talk to someone who's been there before. And I think this, just definitely helpful.
That's great. Well, Jan and Maria, do either of you have any questions or things that you'd like to talk about tonight? We have another 15 minutes. We're halfway through.
Trying to think of something that has come up this week since I talked to you. And I'm like,
Okay.
it's been a pretty good, I'm getting paid and
Yay.
yes. We talk about Oyin things like I had a client that wasn't sending in the money. And Sharon and I talked about it, and the gal actually wanted to, but she really needs somebody to help her decrease some of the fluff around her life because she was forgetting, and it wasn't a matter of money or not wanting coaching. She wanted it, but Sharon helped me write the right kind of message to her to keep it so that it was open, and so she paid right away. She continued, and we're meeting Thursday. So that was I had not had anybody like that before. So there's just a lot of little pieces and parts that show up and you go, oh, nobody told me this. So nothing, I can't think of anything new this week. I'm sure tomorrow it'll come up maybe,
Okay.
but I'll be back here tomorrow.
Okay, great.
I did want to say something to Oyin, and if anybody else comes on, that's about trying to watch the video tonight if you can.
Oh,
And there's 3 questions. They're real easy, but there's going to be a drawing.
Oh.
So Sharon's going to give away
one of the courses. Yeah.
One of the courses, yeah.
Okay.
So if you have time, and if you don't, there's a different prize every day this week. So if you miss one, don't worry. You can go for the next one. It's 5 chances. Actually, there's 6 chances to win, because when the whole 5 days are over, there'll be a grand prize with another couple questions. Every day has a couple new questions, and you got to watch the video to answer the questions. So it makes it kind of fun, a little motivation to watch them. And you have till midnight Pacific time, so you've still got some.
Okay, so we got 4 hours extra.
Yeah. And did you come into our Facebook group for the?
So I went on Facebook through the instant messenger and went in through that, but then I saw something come in through my messenger briefly that said there was a message about the meeting tonight or some meeting, and I was still at work, so I wasn't able to click in and get it. But then I went back and I didn't see that message, so I was kind of confused. So I reached out to Jan, and Jan sent me the link via text message. So that's how I was able to get on tonight.
Okay, good. Thank you, Jan. But you have registered, right, for the 5-day event? So
yes, I did register, and I'm gonna make sure that went through, because I'm not sure why I didn't get the link through my email.
Yeah. When did you register?
This was I think, Jan, did you send me that information last week? I believe that.
Yeah.
Yeah, I did it that same day.
Okay. So yeah, you should have gotten an email today that gave you the link to go to the video today.
Okay.
And if you didn't get it, Jan, can you send it to her?
Sure. I can forward that my email, but it's kind of down. There was a couple other things ahead of it, so it was in the lower part of, like there were 3 sections to the email. It wasn't the top section.
Okay.
So I don't know. You may after this, you look. If you need it, just
okay. I'll read
text or messenger, and I'll get it to you.
Okay.
All right. I was thinking it was a higher up, but yeah, it's a link to the video page of today's video. And actually, I'll tell you, all the videos will be on that same page. So if you keep that URL for that page, it's always, every day it's going to be the same URL. It's just, I'm going to add more and more videos down the page.
Okay.
Okay.
All right.
Yeah. Good. Well, I'm curious, those of you who've watched it, the video today, what was something that stood out to you that you enjoyed or you found valuable, let's say? You've heard most of it before, but still, if there's something you want to share, I'd be
I can't
interested.
hear you, Maria.
I just said I'm still thinking. I just think I've heard that messaging a couple of times in different ways, and every time it just kind of hits me in a different way, or I take away another piece. And so I think what I appreciate is how you're able to just really distill it down to what was it, like three things, like knowing your cash runway, your I'm gonna miss number two, but also like having like a support system, right? And your self-care, and and I appreciated how the self-care piece was really emphasized throughout. And
Yeah.
I think that's so valuable because I think about like nurses and self-care and like a nursing education. My personal experience anyway in my nursing education, it maybe was talked about, but it wasn't really like embedded throughout the curriculum, right? And it wasn't practiced in the classroom or in the clinical field. So I feel, and that's what I was thinking about today was like, you're right, with this program, you really do like walk the talk, right? It is highly emphasized and encouraged and reminded, and so it's very much a part of it, and I think that's what also helps make this a sustainable experience because it's not easy always. So those are my takeaways.
Thank you. Those are great. Thank you.
I think one of mine is working with some people who think they want to start a business but don't. They get into people, and this comes back to integrity, which I have talked about with you all before, how much I appreciate the integrity of the program and everything, that they want you to come in with a lot of money and they want you to already be established, and they just want to kind of maybe bump you up a little, but they don't really give you the foundation to do that. And so sometimes what I have seen is people they get into something like that and they don't succeed right away, or they succeed for a very short period of time. And then they're like, well, it must be me.
Mm.
Everybody else must. And I've seen too much of that where it's been people that I know that have gone through classes that I've gone through and have said, I'm not making it. I'm not making $100,000 the first year. I'm not doing this. What's wrong with me? And that just makes me so sad to hear that. And they've spent quite a bit of money. They've got a loan, kind of like people with student loans that never finished the class, and they still are paying back hundreds of dollars every month for something that they didn't ever finish.
Yeah.
Because somebody pushed them to do it. It wasn't their passion.
Mm-hmm. Or even if they had the passion, but the course didn't give them the foundation,
right. That's another one. Yeah.
So I've seen it too much too. It's just such a shame. And I think it's so damaging. And, nurses are just sort of emerging, beginning to become entrepreneurs in a big way. There've always been a few, but it's really picking up steam. And it's so important to me to see us succeed. I don't just want to see a whole bunch of more disappointment and more disillusionment for nurses. I want to see us really do this thing because we have so much to bring to the public. There's, and it's just too valuable. It's not an opportunity I want to see squandered. And so I really believe so strongly that the basics, just like in health, like how much sense does it make for us to learn all these advanced techniques with health if we haven't done the basics, right? Because those are foundation. And it's just, to me, it's just the same way in business. Do the basics. In fact, doing the basics well, you can go a long way in your health if you do the basics well, right?
Yeah.
Right.
And it's the same way in business. So, yeah, it's my little soapbox. Well, we have just a few more minutes, then we'll wrap up. Oyin, do you have any other questions or comments?
So I'm just kind of taking notes right now, and then my plan is to watch that video tonight.
Good.
You'll have more videos tomorrow, I'm assuming, and then
Every
another.
day there'll be about a 20 to 30-minute video.
Will there be another meeting like this tomorrow as well? Okay.
Every
Okay.
night.
Every
Mhm.
night.
Yeah.
I plan to be here tomorrow. But since we have church on Wednesday and Friday, I won't be here Wednesday and Friday, and I have a wedding, I think, on Thursday, but I definitely plan to be here tomorrow. I was going to say, Oyin, if you have your friend or something.
Yeah, I'm actually open tomorrow night at this time at 7 o'clock, so I should be able to do that. Wednesday, it just depends. I may or may not, but Friday for sure I won't be able to because of church, but Thursday I should be able to get on.
Great.
So
It'll
how
be
long
fun to have you.
doing this, Sharon?
Pardon me?
How long have you been doing this, nurse?
I've been a nurse entrepreneur since 1984.
Okay, it's a long time.
It's a long time.
You don't look like you've been doing it that long.
Oh, yeah. I've been doing it a long time. And I've had a lot of different businesses, both for-profit and nonprofit. And, and a lot of them in the beginning years, I would part-time work my business and part-time be in a standard healthcare position. So, I have a lot of experience in both because of that. So, yeah, I thought about retiring, but during COVID, I just got struck with this massive calling to share what I'd learned over my decades of experience, to get it out there and share it with nurses. I was like, yeah, I got to do this.
Yeah.
So I started this business during COVID.
Okay.
Yeah.
So have you worked with like nurse practitioners or PAs in the past, like with this entrepreneur?
Yeah. I haven't a whole lot. Mostly
Okay.
I've worked with nurse coaches,
Okay.
but I'm an advanced practice nurse myself. I'm an
Okay.
APRN, and
Okay.
I've worked in integrative healthcare, medical clinics as a wellness coach.
Okay.
And I've had my own practice especially in nutrition, and supplements, to correct health problems. I also started my entrepreneurial path as a massage therapist and body worker. That was before I had my advanced practice degree. So, I've had private practice experience as an entrepreneur, group practice, because my husband and I owned a group massage therapy business in a hospital, in a medical system for a while, but we owned the practice. And then, the nonprofit and all that kind of stuff. So, but as far as you're thinking about individual private practice for yourself?
Right.
Mm-hmm. Okay. Yeah, well, I hope you come back some more this week and we can talk more about that.
Yes. Definitely.
Okay. Great.
Thank you so much for all of that information.
You're very welcome. My pleasure. This is what I love to do.
Thanks.
Okay, good night, everybody.
Good night.
Oyin, contact me if you can't find the link for tomorrow.
Okay, I will.
All right.